It's when you least expect it that someone is running through the middle of the room with a crashing patient. I do find that people are often asking me in the clinic what if we just take them home and let them die peacefully at home? And the sad reality of that is that death at home usually is not peaceful. I try to take, even if it's just 60 seconds to a minute after euthanasia, to just truly feel the feelings, acknowledge that was someone's best friend, acknowledge that was someone's worst day.
Welcome back to Tales of Fluff. I'm AJ.
And I'm Emily. We hope you are all having a great week and soaking up these last bit of summer days.
I still cannot believe that it's August already. This year is just absolutely flying by. But we're so glad that you're choosing to spend part of your day right here with us.
We really are, and we have an incredible conversation lined up for you today. We are so excited to introduce you to someone who has quite literally seen it all when it comes to our furry best friends.
This line of work takes a very specific and incredibly passionate person to handle each case with compassion and empathy. And today's guest does exactly that. We chatted with Dr. Nicole, an experienced emergency veterinarian who has been on the front lines of animal healthcare for over a decade.
She talks about what it truly takes to be an ER vet, the impossible decisions, the incredible miracle cases, and the intense emotional toll of the job that the internet rarely talks about.
It was such an eye opening conversation. So grab your pet, get comfortable, and let's jump in. We started by asking Nicole how long she has been a vet and what initially inspired her to go down that path.
So I've worked in the vet med field since 2015. That's when I got my first job. And it was actually in emergency medicine specifically that I got my first job. But I have been a vet since 2022. It took me about 3 tries to get into vet school. Honestly, I don't really know what inspired me to be a vet. I don't remember a time in my life where I didn't wanna be a vet. I think that was probably partially encouraged by my parents at a young age and me just loving animals. And then I feel lucky that along the way, kind of each milestone that I hit, I enjoyed science, I enjoyed college, I enjoyed the different steps that it took to get to this spot. And so it was honestly the only plan I ever had.
It took 3 tries to get into vet school. I like that she shared that bit right off the bat.
It really goes to show you that if you really want something badly enough, you do not give up.
Exactly. Now, I feel like way too often people picture veterinarian medicine as just lighthearted days playing with puppies and kittens. But Nicole paints a very different picture of what is actually happening behind the scenes.
I think we all enjoy the days where it feels like, at least for a brief moment, we can play with puppies and kittens. But there are definitely a lot of things behind the scenes that I don't think the average person sees or at least thinks about. And one of those big things is finances. We get into vet med because we want to save animals, we want to help animals. And one of the hardest parts is we find ourselves often talking about finances. And the reality is that a lot of decisions are driven by finances. And that can be one of the hardest things, both for I know for me as a vet, my friends as vets, but also as the other staff members that are kind of all included in that decision-making process. And then we also have to help people to make decisions. And I think that's one thing that you don't really think about. It feels kind of like an equation. There's something wrong with the pet, you figure it out, you treat it. But there's a lot of decision making that goes into that process with the owners having conversations about all of the options, and then at the end of the day, them having to choose those options and you helping them make that decision.
It's interesting because when I asked her this question, finances was honestly the last thing I expected her to bring up.
I didn't expect it either, but the way she explains it makes so much sense. It's the driving force behind so many of these heavy decisions. And we wanted to dig a little deeper into that. So we asked her what she thinks is the most misunderstood thing about ER vets specifically.
So, kind of going along with that previous question, my job is not just medical. It has to do with decision making, with kind of morally thinking about what the best option is, both for the pet and for the owner. And then again, dealing with those finances. And at the end of the day, we're not trying to sell medicine. We're definitely not in it for the money, but there is that conversation about what is best for the pet, but also what is best for the owner. And a lot of times, what that entails, especially in my job with emergency medicine, is that it is a little bit more expensive than some of the prices that they may used to be seeing. And there's a lot that goes into those prices being a little bit more expensive in emergency medicine that I think that the average person might not understand. There's a lot more training specifically to be in emergency medicine, from anything between using the additional equipment to doing CPR. There's more staff involved. I think just thinking about the number of staff that it takes to run CPR alone is realistically the number of staff that we want to have at all times, whether we're busy or not. And the specialized equipment that the average general practice veterinarian might not have. In addition to, we are there all night. And so just the number of staff it takes kind of on the roster on a daily basis to keep that open is really the main reasons that it's a little bit more expensive. And then one more thing that I think is a big misconception in my job, I hear the phrase over and over, "Oh my gosh, your job must be so sad. It must be so sad. I don't know how you do it." And while there are so many sad parts of my job, there are so many wins. And when there's wins, they're really big wins. And I think that's what a lot of us thrive on and what a lot of, us are fueled by are those really big wins despite having a lot of really sad stuff that happens too.
That puts so much into perspective. Between the specialized equipment and having a fully staffed team ready at 3 a.m., it really helps you understand what's behind that heavy emergency bill.
It does. It might not make the bank account feel any better, but that kind of transparency is so reassuring.
Exactly. Just having that understanding makes the whole process a little less scary. Now, working in an environment where things can turn critical in a split second definitely leaves a mark. So, we asked Nicole, what is one sound in the ER clinic that still makes her heart drop, no matter how many years she has been doing this?
So I think it's probably not what most people think. The first thing that comes to mind when I'm asked that question is actually the sound of someone running. Every time that makes my heart drop. And sometimes it turns into, a funny joke that they were not running for any specific reason, but just hearing the pace of someone in the background moving quicker immediately makes my heart rate spike, immediately makes me kind of go into that mode of what's going on because it's when you least expect it that someone is running through the middle of the room with a crashing patient. But also, the sound, there's a very specific tone that my staff members will say my name in that I know their brain is not quite processing what is happening, but they just know that it's bad. And usually that's specifically when it comes to hospitalized patients. They'll be going throughout their night taking care of that patient, and then they go in to check on it, and their brain hasn't quite figured out what is wrong, but they yell my name in a specific tone. And that also makes my heart drop.
I could honestly feel my own stress level go up just listening to her describe that.
Same here. And it's wild that it's not just the sound of running, but knowing your team so well that just a specific tone of voice tells you something is wrong. That shows an incredible connection with her staff.
It really does. And taking that kind of care into the harder moments, a very real part of this job is inevitably dealing with the end of a pet's life. We wanted to know what common misconceptions are out there about how animals experience their final moments.
So I think this is a really good question. And I think probably something that I've not really thought about very deeply before. I think there's a few different aspects to the end of life when it comes to animals that do make it very different from humans. And I think, our natural, the kind of human nature of things is to kind of compare it to humans. And I think there are a few different aspects that are different. I think one of the big things is having a choice in the matter is one of the big things that differ in kind of the end of life process with a pet, both in the sense of, the owners have a huge weight in being the decision maker in that process, but because there is a decision in that process, it doesn't always look the same as human medicine. So, I don't, in my experience at least, it doesn't seem like the animals, at least in the hospital setting, know that it's coming. I think that there are some different behaviors that they may exhibit at home that kind of indicate that they know that they're sick, but they don't really seem to kind of have that moment where they know that it's coming. And they also don't really seem to have the kind of concept of waiting for their owners, at least not something that I've experienced. I know in human medicine, there's stories where people kind of wait until their family member get there and then wait until they leave the room. But I think because of the process with animals, we don't quite see that, but I'm sure that evolution with animals kind of also play a little bit of a role in that. And then on the human aspect of things, I think that a lot of people in their mind think that they're going to know when it's time and they're going to know it's going to be obvious that it's going to be a feeling that they're just going to know that is the time for their pet and make that decision, but it's rarely that straightforward. And the medicine is also rarely straightforward in those moments. So it does turn into a conversation about really thinking about quality of life and the trends over the last few weeks or few months, and then trying to break it down into a more logical, tangible thought process to make that decision. And then the last thing that I want to cover when it comes to the end of life decisions is it is in the hospital, in the setting where we're choosing to move forward with euthanasia. It is a very peaceful process in the clinic. We do use the same medications that we would use to induce anesthesia. And so it's not something where they feel it coming. They basically would have the same feeling as if they were about to go into a surgery, and then it's only after that fact that the pet is euthanized. I do find that people are often asking me in the clinic is, what if we just take them home and let them die peacefully at home? And the sad reality of that is that death at home usually is not peaceful. And I do find myself having that conversation frequently, that a lot of times the ailments that the pets have where we know that they're having a hard time either are, realistically are not going to be as peaceful as I think people imagine it at home. And when we have those conversations, that often does change people's mind and they didn't realize that. And then they do make the decision to move forward with euthanasia in the clinic.
Hearing it explained like that is incredibly comforting, knowing they don't have the same sense of dread we do, and that the clinic process is really just like falling asleep for surgery. It takes a lot of that fear away.
It really does. It gives you some peace of mind, even though making that decision is always going to be heartbreaking. And because those end of life decisions carry so much weight, we wanted to ask Nicole about the times when things aren't as clear cut. We asked how she navigates situations where her medical recommendations and the owner's wishes just don't align.
So I think this is a really good question, and it is something that we do experience often. And my job, first and foremost, is to advocate for the pet and to make my recommendations. And once we have that conversation and questions are answered, and I feel that I've communicated the recommendations in a way that the owner understands, then and kind of understanding what the pet is feeling From there, I have to switch into trying to understand the human side of things because it does switch into it is their choice. And there are so many different reasons why people make the choices that they make. And we may never understand those. It's something where, maybe somebody needs to hear it twice. They need to hear it from me and then they need to hear it from their regular vet. They may be in a situation where they didn't plan to come in to see me. They really trust a regular vet, and maybe they need to hear that a second time or from someone that they trust. It's also, I try to think of it as I'm telling them this scary news, and I'm also giving them a big bill and associated, going along with that. And I know just if I were to think of this in a totally unemotional way, thinking of something else in my life that's happened, if I take my car in and I think that I just need to fix the brakes and they give me a $3,000 bill, in that moment, it's really hard to make a decision because you have to wrap your head around it's different what you thought, it's going to be expensive. You have to think about your options. And I think that when we see a pet that in our eyes we think is suffering, I think it's easy to be blinded by that and not think of the other side of things. And I think there's so many steps in grief that it's important for the owners to follow what is going to be best for them. And I don't want them to ignore what's best for the pet, but I do think that because pet owners have a choice every step of the way, that a lot of times they have to do it in their own way to process grief in what's going to be the best way for them. And if that is them going home and thinking about it for a day, then honestly, that's something that I support. And I'll be honest, if I think that if we can achieve comfort for that day, and if the pet is going to pass sooner than that. But I think it is something that thinking about the human side of things does help me to step back and realize this is an individual person that has the weight of making all the decisions. And sometimes people need friends, family, time to hear it again, the support of another veterinarian in order to get to that decision. And my biggest thing is, at the end of the day, we're thinking about the pet first and foremost. And judgment usually is not helpful in these situations. And I want the owner to feel comfortable making whatever decision that they end up making and feeling like this is going to be a safe place to come back to if they end up changing their mind. And it's okay to change their mind if that is something that they're able to do or interested in doing after having some time pass.
I really respect how she leaves judgment out of it completely. She realizes that when you're suddenly hit with that terrifying diagnosis and a massive vet bill at the exact same time, it can be overwhelming.
Definitely. Giving people the space to process that kind of news without making them feel guilty is such a compassionate approach. Now, to give our own emotions a little bit of a break, we asked Nicole to share a happier outcome. One of those true miracle cases where a pet absolutely shouldn't have survived, but somehow made a full recovery.
So this is something that honestly is probably one of the most common questions that I get is, what's the craziest thing you see or, what's a miracle that you've witnessed? And in general, I do think some of the stories kind of blur together a little bit. There's a lot of situations where I think that a pet wouldn't have made it and they did. A lot of situations where I really thought a pet would make it and they end up not. But there is one case that comes to mind when I'm asked this question. And it was a small dog that presented for vomiting, but when it got to the clinic, it was having a seizure and also in respiratory distress. We did some blood work and the kidney values were elevated. And we also did x-rays and there was evidence of a blockage that he ate something that was stuck. And this pet, obviously, at this point, has had a list of things that are all very concerning. And we had a realistic conversation with the owner. They approved stabilization. So we worked really hard to stabilize the pet over the first 4 to 6 hours in the hospital. And having to weigh basically when we go to surgery is a really hard decision in those cases when they're so sick because the surgery they need the surgery to get better, but we also want to time that up to where we don't put them at a higher risk of passing during the surgery. So I did the surgery. It was a hazelnut that was causing the blockage. And this pet, its kidney values had improved before surgery. It was out of oxygen. And we found that the reason for the seizures was low calcium, which was a fixable problem. But after surgery, the pet just wasn't doing well. It felt like every day when we were calling the owners, we were saying a similar update of, still not eating, still a lot of fluid in the stomach, still regurgitating. And like I had mentioned before, one of the hard parts about my job is usually money is a limiting factor. And fortunate for this pet, money was not a limiting factor. And so the owners each day said, let's just keep going. And I don't remember the exact number of days this pet stayed in the hospital, but well over a week. And he went home and he did great. And he did so great that he actually came back to us about a year later for another blockage and got the opportunity to have another surgery. Thankfully, that one wasn't as serious. But that case really stands out to me because it was a huge moment in my career where I realized that maybe we're not as far behind as in regards to human medicine as maybe I previously thought. We don't always get the chance to see what our medicine can do. And so that was a really cool moment for me to realize that, while most people on days 3 and 4 were having a conversation about prognosis and, if this pet is going to make it and if we can afford to get them there, this pet was a cool reminder that there's probably a lot of situations where the medicine can save these pets. And it was a pretty cool case to see.
I absolutely cannot believe it was just a hazelnut. It's always the tiniest, most random things they manage to find when we aren't looking. But seeing a dog pull through something that serious just shows how incredible emergency vets really are.
It's so true. And it got us thinking about the animal's perspective through all of this. After going through surgery and being in the hospital for a week, do they actually realize what the vet did for them? So we asked Nicole if she thinks pets understand when she has saved their life.
I honestly wish I wish that were the case. I think sometimes maybe we convince ourselves that's the case. These animals that are in the hospital, we definitely create bonds with them over time. We kind of watch them get certain preferences for certain nurses over others or certain doctors over others. But honestly, most of the time, if they start getting annoyed with us, they start biting, they start showing their personality, getting sassy, making our jobs harder, usually that's the indication that they're getting better. And we welcome that, especially little dogs that the owners let us know, hey, just so you know, I'd be careful. I'd put a muzzle on him. And they're not doing that when they first get to the hospital. And then they start, we all get a little excited to see their personality show. I think what's more profound is the bond and the trust that they have with their owners. One of my absolute favorite parts of my job is watching pets see their owners, whether that be during a visit or when they're getting ready to be discharged. I think we all convince ourselves that, oh, this dog loves us. And then they see their owners and they just light up. Their whole demeanor changes. They get so excited. And that's honestly one of my favorite parts.
It's honestly so great that the staff celebrates a pet getting a little grumpy because it just means that they're finally starting to feel like themselves again.
Right? And to hear the ultimate reward for the ER team is just seeing that pet light up when their family walks in. It really shows how much heart goes into what they do.
It takes a massive amount of heart, but carrying that kind of emotional weight every single shift, it absolutely has to take a toll. We had to ask Nicole how she manages the pressure, protects her mental health, and how she handles burnout in such a demanding field.
This is a huge topic, both in emergency medicine, but also in veterinary medicine in general. And I think the biggest thing that I've learned is that burnout is inevitable in my opinion, and it doesn't happen overnight. And so prevention is so important, but it's also ever evolving. I know that for me specifically, the burnout prevention that worked before vet school versus during vet school versus after vet school are very different. And in that way, burnout has creeped up on me a few different times, even though I've spent a lot of time and effort trying to prevent it. I honestly feel lucky that I got to experience burnout pretty bad before vet school because I think it gave me an additional leg up on getting ahead of burnout and also starting the process of learning what helps me to prevent it. There's so many different aspects to burnout that I'm realizing too. I think that when we initially think about that topic, we start talking about things like self care and support system, which are definitely a big part of it, but food, sleep, having a routine, and not only routine in your daily basis or your work life, but a routine as simple as when you do perform a euthanasia, doing whatever you need to do to both process that, but also continue your day. So for me specifically, I try to take, even if it's just 60 seconds to a minute after euthanasia, to just truly feel the feelings, acknowledge that was someone's best friend, acknowledge that was someone's worst day, and feel that in that moment. And then before moving on with my day. For me, another aspect of burnout prevention, and I think this is probably something that would be the case for a lot of people, is reminding yourself to be positive, catching yourself in that negative mindset, and just reminding yourself of the good things, making sure to deal with the emotions that you're feeling on whatever timeline makes sense for you, but definitely sooner rather than later, and creating a full life outside of vet med. In vet school, one of the things that I tried to be extremely conscious of was not making vet med my entire life. What that looked like for me was taking every Saturday and not allowing myself to do any schoolwork on that day, and also not spending all of my free time in clubs and events and that sort of thing. Another thing about burnout prevention is figuring out what your cues are. For me, I've learned that if I'm a little bit more negative at work, if I on my days off want to stay home a little bit more than usual, if I'm a little bit more grumpy at home, those are all cues that, okay, I really need to get it into gear and be a little bit more intentional about the burnout so that it does not end up affecting my personality at work.
You brought up a good point, and it never even crossed my mind that obviously vets have to, do the euthanasias, but then their day still goes on. It's amazing how you guys have that, that strong mental health of performing a euthanasia, taking some time, and then going on with your day because you just saw a family's life get completely destroyed and they're very emotional. But then maybe in the next room, you have a family that just got a puppy and needs its, first set of shots. So you have to kind of balance that out. So that's amazing, Nicole.
Yeah, and I think it's something that a lot of vets talk about and experience. And I don't think enough of us take the time to just sit at our desk or, walk in the break room or get a breath of fresh air after a moment like that. I think we feel the need to turn it right back on and start talking about your infections and allergies. And I think that we would all benefit from giving ourselves the space to just process that even for an extra 60 seconds.
Taking those 60 seconds just to truly feel it before moving on, that is such important advice.
It really does change how you look at your vet walking into the exam room. If they're running a little behind, they might have just had the hardest conversation of their day right before greeting you with a smile.
Exactly. And hearing about that constant emotional balancing act made us wonder about the future of the profession as a whole. So, looking ahead, we asked Nicole what changes she hopes to see in the veterinary medicine over the next 10 years.
That is a really great question. And I think that one of the things that I'm starting to think about more and more is I'm hoping that in the next decade, there is a little bit more emphasis on the human side of veterinary medicine. There's not a lot of studies that look at kind of the decision making when it comes to clients, the way that they're thinking, the way different aspects of the client side of things when it comes to veterinary medicine. So I would love to see more studies on that. I think that would really help us to have conversations with the clients. I also hope that grief counseling is something that becomes a bigger part of our education, whether that be in vet school or out of vet school, because while we're not grief counselors, we are the first people to interact with the client in those first stages of grief. I also hope that we continue to improve the culture of veterinary medicine in a way that can prioritize long and fulfilling careers for every level of vet professionals, from the vets to the receptionists to the vet techs and nurses. And then one of the things that comes to mind often when someone asks me this question is I know that insurance in general is a controversial topic, but I truly, truly think that both pet owners and pets benefit from pet insurance. I think it's something that helps with decision making because it can take that financial aspect, at least partially, out of the equation. I think it allows pets to have earlier interventions, and it allows some of these really expensive but fixable diseases to actually get treatment. So, overall, my biggest hope for the next decade of vet med is I want it to become a profession that has good medicine, compassionate communication, financial accessibility, and staff well-being that all support each other and is not something that is constantly competing against each other.
Integrating grief counseling into veterinarian education makes so much sense. Like she said, they are the very first ones there when that grief hits.
Absolutely. Her vision for a more balanced, more supportive industry is something we can all root for. And honestly, hearing how much she cares about having this field better for everyone just highlights why she is so great at what she does.
For sure. And even with all the heavy realities she shared today, her passion is so contagious. So, if anyone listening is feeling inspired by her journey and thinking about stepping into this field, we asked Nicole what advice she would give to an aspiring emergency veterinarian.
So one of the cliche pieces of advice is definitely going to be to get experience. I got a lot of experience in emergency medicine, and that allowed me to be sure that was something that I was interested in. I got to see the good and the bad sides of it and was able to fully make that decision based on that. But getting experience in more than just what you think you want to do, because your mind will likely change. I think one thing that I hear people say commonly is, "Well, I care so much about animals, so I could never do your job." And I think it's something where caring deeply about animals shouldn't deter someone from wanting to enter this field, especially because there's so many different ways to help animals. There's so many different jobs that aren't just being a vet. I think our culture encourages people to, if you see a little girl that loves animals, I think our culture has the habit of saying you should be a vet. But my advice would be to explore all aspects of ways to work with animals, including, being a manager, being a vet nurse, being a caretaker, doing some of the things like counseling people through their grief, working at shelters in any capacity. So that would be another piece of advice I have is just to don't feel like you have to be a vet. Look into all the different jobs because each one, based on like your strengths and weaknesses, might be a better fit for you. Another piece of advice would be to pay attention to what brings you joy, what helps you reset. Because, like I've mentioned over and over again, this job is hard, it's emotional, burnout is inevitable. And so, just paying attention to those different things as you're growing up and going through school on what stuff does truly help you will give you a leg up in this career. And lastly, do not let anyone tell you can't do it. It is something I had so many people tell me that I should give up on my dream, that I should switch careers, that I should not be a vet, or I should be a human doctor instead. And although it took me 3 tries to get into vet school, I couldn't be happier with my career.
What great advice. Get out there, get the experience, never give up on it, even if things don't go exactly as planned.
We want to give a massive thank you to Dr. Nicole for taking the time out of her incredibly busy schedule to join us. We truly appreciate her sharing the highs and the lows and the reality of what it takes to advocate for our pets every single day. We'll have a link to her work down in the description.
We hope you guys enjoyed this episode. We appreciate every single subscribe, like, share, and listen. It means the absolute world to us to see this community grow. But today, we aren't asking you to do any of that for us.
Instead, if you come across an ER vet, even if you just see them on social media, please take a moment to thank them. The emotional toll they take on and their absolute dedication to helping our pets when they need it the most should never, never go unnoticed.
I completely agree. They really deserve all the credit for what they do. And we actually want to start the wave of appreciation right here. Drop a comment below about a time a veterinarian made a massive positive impact on your pet's life. Let's fill the comment section with some amazing stories of healing and gratitude.
Until next time, remember, the greatest medicine we can offer is compassion.